Hello, and welcome to the Rosewood Institute webinar series, The Role of Nutrition in Addiction and Detoxification. My name is Nancy Berry. I'm the Marketing Manager for Rosewood Centers for Eating Disorders, and joining me in our studio today is Megan Niskern. She is the Executive Nutrition Services Director at Rosewood Centers for Eating Disorders and brings 10 years of experience working with wellness programs and eating disorders in men, women, and adolescents. Time permitting, at the end of this webinar, Megan will answer your questions, and I'll also go over the instructions for getting your CE certificates. At this time, I'm going to turn it over to Megan as she presents the role of nutrition in addiction and detoxification.
Thanks, Nancy. Good afternoon, everyone. Thanks for joining us on this Friday. I wanted to start by a little bit talking about what it was that got me interested in doing this topic. Having received my master's from Arizona State University in human nutrition and dietetics, I got into the field of eating disorders somewhat accidentally and really found that I needed to learn a lot of what I was going to be doing on the job. I went to different kinds of education conferences, symposiums. I also did a lot of my learning on the job. And when it came to understanding addictions and the detoxification process, which we'll talk a little bit, or a lot actually, about how those two play into each other, I realized that that was yet another area I really didn't have a lot of understanding and knowledge in. And over the course of my experiences, I've really become much more comfortable working with this population and the need that they have for that dietary, that nutrition support. So I thought this would be a terrific topic to bring to our webinar series, and hopefully it will be as interesting for you all as it has been for me putting this together. So we'll go ahead and get started. A little overview of what we're going to be talking about this afternoon. First, we're going to review some of the different medical concerns that are associated with alcohol abuse and substance abuse. I'm not going to go into every single piece because this would not be a 1-hour webinar. It would be a full-day seminar. But I'm going to just kind of touch on some of the key components and some of the things that are a little bit more associated with the nutrition aspects as we're talking about that today. We're going to discuss how appetite is impacted during the use and also during the withdrawal and detoxification process, because those are very different for some of the different substances that we're discussing today. I'm going to go through some pretty specific nutrition support for recovery recommendations. It's difficult, again, not being in person for you to ask your questions, but I'm hoping to touch a little bit on all the different areas so that you'll have a little bit more of a clear understanding after today's webinar. I'm going to talk about the eating disorder prevalence within this population, within addictions, chemical dependency, substance abuse, that type of thing, and some of the red flags to look for, a little bit more of a specific way for you to assess eating disorders within the addictions population. And then I'm going to talk just a little bit about some long-term struggles with the medical and nutritional components of recovery with regards to this population specifically. So without going into too much of the chemical and biochemical science associated with alcohol metabolism, I did want to do a little bit of a breakdown of what happens within the body specifically. So alcohol metabolism does not require digestion. It's actually absorbed. Those are two different things. Digestion is an entire breakdown process. Absorption is that it can really just kind of come into the body very readily, very easily. And this can happen actually more so when the stomach is empty. A lot of times people talk about how they're not going to eat dinner so they can get drunk faster or get intoxicated quicker. So there is a lot of truth to that. In fact, 20% of alcohol intake is absorbed directly through the stomach wall. And then the remainder moves through the small intestine where the majority of the absorption actually takes place. This is a very rare occurrence. Not many substances are able to be directly absorbed in the stomach. Oftentimes it goes through the small intestine, even into the large intestine before absorption takes place. Alcohol can actually reach the brain within 1 minute of ingestion. So if you think about the ability of alcohol as it turns into ethanol within our body, and its ability to reach different areas of the body in that quick of a time frame is really unheard of when it comes to how food is metabolized and how other things are metabolized within our body. Once alcohol is in the blood, it travels to the liver, I'm going to talk a lot about the liver today, and this is where it's oxidized by the enzyme alcohol dehydrogenase. So what's really interesting about that specific enzyme is the fact that women actually produce less than men. So this also kind of plays into some of the different concepts around how alcohol consumption takes place. Women can go on an empty stomach and then produce less of this enzyme and therefore can get intoxicated, get drunk a lot faster, whereas men have higher tolerances and are able to have a little bit more alcohol before they start to feel the effects within the body. And one of those reasons is the production of this enzyme. Our liver actually prefers to have fatty acids as fuel. So the fatty acids are turned into triglycerides and they're carried throughout the body. Our liver is essentially producing things in order to get rid of waste. And so what happens when alcohol is brought into the mix is it takes precedence over the normal function of the liver. So ethanol, as it comes into the body in the form of alcohol, stops the liver from doing exactly what it is that it wants to be doing. And it essentially says, I'm here, you need to pay attention to me, and the liver really likes the ethanol. It's actually very easy for it to process. So what that does is it leads to a fatty acid buildup once somebody has had too much alcohol intake. We're going to go into how that plays into things more in detail here. So when you look at somebody who's suffering from alcoholism, someone who's an alcoholic, we talk about the fatty liver, and this happens, like I was saying, with fatty acid buildup. With this process, liver cells can actually be permanently damaged. When the liver becomes overwhelmed with alcohol metabolism, the excess ethanol, because the liver can't actually metabolize everything as it's coming in for somebody who is a heavy drinker. Technically, the body can metabolize 1 alcoholic beverage per hour. Most people, when they're dealing with alcoholism, don't just drink 1 drink per hour. That's really not the definition of alcoholism. So what's going to be really important is if somebody is doing moderate alcohol intake, the liver can really handle it. It'll process the alcohol. It'll go back to doing its normal functions. When someone is overwhelming it, it can't process it all at the same time. So this excess ethanol will travel all throughout the body, and it's causing damage along the way. It's waiting until the liver has kind of queued it up and is ready to process it. We're going to talk about some of the damages to critical body systems and the different times of metabolism that is interfered once somebody has excessive alcohol intake. So if you're sitting at your desk eating lunch right now, you may want to just put down your fork for a second. So we have some pictures here, and I wanted to discuss with you a little bit about alcohol cirrhosis. Cirrhosis of the liver is really one of the things that is most damaging when it comes to somebody who is an alcoholic. On the left side, you're looking at a healthy liver. This is just a normal liver, normal functioning. What can actually happen is, let's say our Tempe facility is located on the Arizona State University campus, and I'm sure on any given Thursday, Friday, Saturday night, there's kids out there that are binge drinking. Even one night of binge drinking can actually cause fatty liver. The cool thing about the liver is it has the ability to fix itself. It has the ability to regenerate. And so one night of heavy drinking, yes, you can have a little bit of a side effect the next day, the next few days, but the liver is going to take care of itself. If you're doing something like that all throughout the day or on a regular basis, or you're consistently overwhelming the liver, what's going to end up happening is you're going to be starting to look at having that fibrosis or that fatty liver. So the image in the middle is really what we're talking about here. So what happens is because the cells in the liver are overwhelmed by the alcohol intake, they're going to start to die. And once they start to die, that scar tissue begins to form. Now, the liver actually can function without the entire liver being available. So if parts of the liver have scar tissue or parts of the liver have died, there's actually a lot of functioning that can still take place. And through that functioning, the liver can actually start to regenerate and essentially start to fix itself. But what ends up happening over time, over continued alcohol intake, is that cirrhosis of the liver begins to happen. About 10 to 15% of alcoholics end up with cirrhosis. This is an extreme damage. I mean, even if you just look at this picture, that does not look like any sort of healthy organ that I would like to have in my body. So I can only, you can only imagine how long and how much damage has actually occurred to this particular organ. I could have put a lot more fun pictures in here, but I thought that this would just suffice to describe the amount of damage. And it may actually be something that clinicians or dietitians should really expose their patients to. If somebody were to see what it was that they were doing to their body, oftentimes kind of out of sight, out of mind, well, if you were to envision what your liver is essentially going through and what it looks like, that can actually have a really powerful effect. So this extreme damage starts to become irreversible. And once regeneration is unlikely, then we start to have a lot of systems that begin to break down. With cirrhosis, I'm going to go through a few things that aren't detailed in your slides, some different things to look for. So with this scar tissue, all of the blood flow and all of the different functions of the liver are now essentially being interfered with. And some things that can start to happen throughout your entire body include redness of your palms. Oftentimes with alcoholics, you'll see that they have very, very red palms. You'll see shortening of finger muscles. So what will end up happening is they can't fully extend their fingers. They'll kind of be like a curling of the fingers. They'll have white nail beds, very white. You can kind of touch your nail bed and see that it turns white, but it becomes like a white, almost a yellowing color within the nail bed. And they actually begin to have something called clubbing. And what that is when the tips of your nails start to thicken, the tips of your nails and fingers, I should say, start to actually thicken and widen. Just a phenomenon in the body. Another thing that begins to happen in severe alcoholics is ascites. We're going to talk a little bit about this on the next slide. And then another thing that can happen is a jaundicing, which you start to see a yellow coloring in alcoholics. It happens in the whites of the eyes. It happens in skin overall. It's a yellow-orange, just kind of depending. And a little bit about, again, what the jaundice is without going into too much detail is it's essentially the liver's inability to get rid of waste. Bilirubin is a product of red cell breakdown, which is very normal in the body. It has to happen. And as the red blood cells die, bilirubin is essentially one waste product of that. Normally it goes into the liver, it processes, it comes out it goes into the bile, it goes through the GI tract, and it comes out in our bowels. Bilirubin is what turns our bowels brown. When it's not able to be processed effectively in the liver, what ends up happening from there is it builds up within our body and it causes that yellowing color. So it is definitely a sign, an outward sign, that there is severe liver damage and dysfunction. So let's continue to talk a little bit more about some of the nutrition therapies, some of the nutrition interventions when it comes to alcohol cirrhosis. So this image on the left, this was one of the nicer images that I could find, shows the ascites that I was talking about. So you can see, and what this is in the stomach area, is it is an excessive amount of fluid that is essentially building up within the body. And this goes back to the liver's inability to function and get rid of waste. So a lot of times I think what I think about when I see the ascites is the concept of a beer belly. People will talk about how they went out drinking and they have this beer belly. Well, beer belly really comes from this ascites, which is very real in somebody who excessively drinks. They actually need to go in, the fluid does need to be drained, and there are some different nutrition interventions that can happen in order to support not having this happen or not having this get worse to a certain degree. One of those things is to make sure to minimize sodium intake. Now, ascites isn't common in all alcoholics, but it is a little bit more of a progressive side effect of the cirrhosis. One thing to do in order to replace the sodium is to use some more herbs and some spices. Use some different oils, different flavorings and that sort in order to spice up the food. In order to avoid high sodium foods, you kind of want to avoid canned soups, some different canned vegetables. Find things that say low sodium or salt-free. Some different processed meats and cheeses can be really high in sodium. Different condiments, different seasonings can have a lot of sodium in them. And then a lot of different snack foods may be higher in sodium. So you'll just want to have an awareness of how much sodium that they're taking in. 2,000 milligrams per day is actually very low. That's a difficult parameter to follow, but for somebody who's this far advanced with their cirrhosis, it's actually going to be pretty critical for them. Another thing to consider is that tastes may have changed. So the damages to the body over the course of time with alcohol abuse can actually impact how food tastes. So one thing that a dietitian should do is encourage trying new foods. We'll talk about how alcoholics tend to eat, but sometimes they'll say, oh, I hate that food. Well, you may have hated that food a while ago, but now it may be something that you actually like. So one thing that you can do is actually go through some sort of a food diary, or have them write down all the foods that they really like, maybe have them keep track of foods that don't taste good anymore, and then looking at those lists, make some suggestions for some quality foods that they could start incorporating and giving a try again. Protein intake may need to be modified by a dietitian depending on the state that they're in with regards to their liver function. There's different indications for doing a higher protein diet, different indications for doing a lower protein diet. It also depends on what kind of malnourished state they're in. As you can see, again, the image on the left, you'll notice the arms, and even you can kind of see through the leg area how thin this person is. So overall, they have this large belly, which is actually just full of fluid, and the rest of their body is actually in a pretty malnourished state. We're going to talk about what exactly that looks like shortly, but something to really keep in mind is making sure that that protein intake is where it needs to be. Daily activity, encouraging daily activity, even short walks is best. You don't want to encourage someone to do activity like getting on the treadmill and doing a jog, or even an elliptical for that matter. But one of the ways that the body can start to heal itself and start to get better is through activity. Getting the blood flow going, getting the heart rate slightly elevated can really be helpful in allowing the body to start healing itself. Bringing that nutrition piece in along with some moderate activity can be very helpful. You want to avoid any foods that may increase risk of infection. So certain foods for the average person aren't going to really have any kind of impact, but some of these foods are more likely to have some different kinds of foodborne illness issues. And so it's going to be important for the immune systems and the body's ability to start healing itself, to avoid different raw meats. That includes raw or undercooked fish, that kind of stuff, raw eggs, anything unwashed. So you want to make sure that you're washing all of your produce effectively. We don't want to have any kinds of different pesticides or that kind of stuff, even though it's there for most foods in a very, 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 very minimal amount. Even that can start to have an impact on the body. Any unpasteurized dairy products, all of those things that could just possibly increase any kind of risk of infection or foodborne illness, you'll want to make sure that they're trying to avoid. That doesn't mean that they shouldn't have fruits and vegetables. They absolutely should, just making sure they take the time to wash them. So moving through a little bit about the alcohol and that malnutrition piece. So going back to that man who was appearing very thin, moderate alcohol intake can in fact increase appetite. I kind of go back to thinking about college-age students that go out drinking for the night, and then they get home and they're starving, and they end up kind of having a little mini binge. So one of the things to consider is, where are they in their stages of alcohol abuse and alcohol addiction? But chronic excessive intake, in fact, serves to reduce the appetite significantly. Alcoholics tend to make poor food choices, and they lack quality nutrients, and that in turn causes that malnourished state. Some things that tend to not be at adequate amounts within an alcoholic are protein, calcium, iron, vitamin A, vitamin C, vitamin B6, riboflavin. And then what ends up happening with somebody who is in a more advanced stage in the alcoholism when it comes to how their body is functioning is some different side effects start to happen within the GI tract. And with that, there's a lack of absorption of vitamin D. We're going back to that calcium piece, phosphorus, zinc, lots of different things can be malabsorbed, fat malabsorption. So what's really important is to make sure that as we're starting to re-nourish these people, that we're making sure that they're getting all of these different essential nutrients. And I'll talk a little bit about some of the best ways to do that. Some additional malnutrition, medical, nutritional concerns include hyperglycemia, having high blood sugars, heart disease. We've talked about liver disease, cirrhosis, actually kidney disease. Imagine once your liver stops functioning effectively, and that's one system for detoxification in the body. Now the kidney has essentially become overwhelmed. It doesn't necessarily begin to detoxify the things that the liver had been working on, but it does also take on a heavy burden. There's different cancers, lots of different cancer risks associated with alcoholism throughout the pancreas, throughout the GI tract, those different areas. There's neuropathy, dementia, depression, insomnia. I've kind of avoided going into a lot of the different behavioral aspects that are associated with alcohol and alcoholism because that, again, would just take us into a much bigger conversation. But there is a lot of different brain chemistry and brain damage that can occur with excessive alcohol intake. So to switch gears here and to start to look at detoxifying somebody that has severe alcoholism, it really, again, is going to depend on the length of time that they have had their alcohol issues and the severity to which they've been engaging in alcohol intake. So I'm going to do a little bit of a combination on how to approach these different things. So the first is, let's look at the alcohol detoxification for somebody that is going to go through some sort of mild withdrawal symptoms. I haven't had to go through alcohol detoxification in my life, but I don't think that anyone would necessarily classify themselves as going through a mild withdrawal. I think that all the stages of this process are going to be very uncomfortable, but there are some different classifications just depending on how severe their intake was prior to. So the central nervous system is essentially going to be in a hyperactive state as they go through mild withdrawal. Because alcohol is a depressant, then alcohol is also something that requires increased amounts of tolerance. So the body has become more and more and more expectant, not just used to, but expectant of this alcohol intake. So with removing the alcohol, we're going to see some significant side effects. The first being insomnia, an inability to sleep, very, very uncomfortable. If we lose our ability to sleep, we're really essentially limiting our body's ability to heal as well. So that insomnia piece creates a tremendous amount of fatigue. You see the tremors. There's oftentimes the shaking and the tremors. Mild anxiety in theory, but for a lot of people this can be a very high anxiety time period. GI upset, anorexia. So we've already had someone who within their alcoholism had no appetite. Now they're going through detox and they have absolutely no appetite. So it's very tricky to manage that along with having GI upset because their entire body is essentially feeding for the alcohol or the ethanol that it has been used to this entire time. So a lot of GI intake, appetite, all of that is disrupted. Headaches can be pretty severe and extensive, different heart palpitations, that kind of thing. So one thing that's always important when doing a medically supervised withdrawal is to be on the lookout for the seizures. Seizures can occur anywhere from 2 to 48 hours after the last drinks. And now this is in generalities. For, again, someone with mild withdrawal, we'll talk about more severe withdrawal next, but anywhere from 2 to 48 hours after the last drink. So you're going to have an extended time frame you're going to want to be closely monitoring for any kinds of issues. Hallucinations can occur. Sometimes they'll say they're audio hallucinations, but oftentimes it is a visual hallucination, and those can begin anywhere from 12 to 24 hours after the final drink, but they do usually resolve within 48 hours. So once you hit that little over 2-day mark, you're generally out of the ballpark for hallucinations. But again, everyone is different. Expect whatever is going to be thrown at you here. So looking at continued detoxification for someone who's having severe withdrawal. So delirium tremens is something that can be suffered by people at about 5% of the detoxing population. This is something that begins at about 48 to 96 hours after their final drink, and this can last upwards of 5 days. So you're not really going to know the severity of the withdrawal symptoms until you've really reached that 2-3 day mark and you see if things get worse or if they start to present as getting better. So again, just really keeping a close eye on everything, keeping a close eye on their mood, how it is they're eating, all of that kind of stuff is going to play into where they're at. So these severe withdrawal symptoms include a fever, disorientation. We talked about the hallucinations. These could be a little bit more severe, a little bit more regular. Diaphoresis, which is actually an excessive sweating. This can be a really good thing. If they're sweating, their body is actually going through a pretty intense detoxification process, and that's a great sign. With that, we want to make sure that we're getting adequate fluid, so we'll go through that as well. Tachycardia, this is a high resting heart rate, hypertension, Vomiting can be nausea and vomiting can be pretty severe when it comes to the detox. We're looking at hypokalemia, hypomagnesemia, and then hypophosphatemia. So all of these are electrolytes. It's going to come back to that excessive sweating, that fluid balance, that vomiting. So we're going to have a pretty touch and go electrolyte situation with the detoxification. So just in case you're not clear, it's a low potassium, a low magnesium, and a low phosphate here. So really wanting to make sure you keep a close eye on those different lab values over this detox period. So let's go into the nutrition support for detox. So we're looking at somebody who up to 10 days, so they've arrived at your facility or they've checked into the hospital, up to 10 days, you're really going to be pushing these first 3 items. You're going to be pushing adequate fluids. For somebody who's got excessive sweating, for somebody who has some of those low electrolytes, you may want to use something that other than just water. You may really want to use something that's got some electrolytes in it to help replenish, and some good things are Gatorade and Pedialyte. At Rosewood, we actually use Pedialyte. It's got a little less of the sugars, the carbohydrates, and it's got a little more electrolytes actually in it. But Gatorade, something like that, is always a good way to go as well. So you want to make sure as you monitor those things that you're giving adequate fluids in order to keep them at a good balance. You want to have foods readily available. We do, at Rosewood, we do just detox. We do people that have no indication of an eating disorder but need to go to an inpatient facility and just have a detoxification. So obviously they are on a different food plan than somebody who is detoxing and even within our eating disorder program. So there's some differences that need to be taken into consideration. We don't, as an eating disorder treatment center, have foods readily available all the time because they'll disappear and we won't know who took them. But for this population, it is actually essential to have some foods readily available. Their intake is going to be very sporadic. One thing that you want to make sure not to have happen is if they have this moment of extreme hunger, that they don't eat too fast. You want to make sure that they're not taking in a large amount of food, because most likely the side effect of that is going to be a lot of GI discomfort and a lot of a side effect with regards to how the body responds to that. So you want to try to push for them to eat in moderation, some small meals, some small snacks, and just have some different foods available as they request things for hunger. You want to encourage the food during moments of less fatigue. So if it's been an hour and they're just clearly having the tremors, they're nauseous, maybe even some vomiting, during that time, don't try to push some saltine crackers on the person. Let them come out of those moments and then try to encourage them to drink some fluids and try to encourage them to have some snacks. And maybe even doing something more like getting them to eat 8 times throughout the day and just doing 8 small snacks. Really try to modify for a person depending on how you see their detoxification process is going. The next step is long-term dietary goals. And in thinking about this, I don't think long-term is really the word that I was looking for. This is something that you're going to be trying to shoot for at about 5 to 7 days, meaning long-term. So up to day 10, we're doing these things. Around day 5, day 7, we're starting to look at some different things when it comes to how they're doing in the detox process. So we're trying to start asking questions like, do you feel hungry when they ask for food? Are they feeling satisfied afterwards? Are they just continuing to have a generalized GI issue? Now, longer term, we're looking at an intake of about 3 meals to 2 to 3 snacks per day. What's going to be really important as their body continues to heal from the alcohol abuse is that we're not overwhelming the system. Doing 3 meals a day is asking the body to do a lot of processing of a lot of food, and it's really not giving the body that consistent energy that it needs in smaller, less overwhelming amounts. So we really want to spread things out. Another piece is to get that balance of their nutrient intake. We talked about how oftentimes they won't make food choices that are high nutrient food choices. So we want to start educating them on getting a balance of nutrients. Working with a dietitian, they're going to be able to push learning what a grain is, learning what some different proteins are, incorporating the dairies, the fruits, the vegetables, the fats. I have an exclamation point next to the proteins because for a lot of people, whether they're dealing with the cirrhosis, really the end stage of that liver disease, or somebody who's still got a functioning liver and they're in a healthy state, but we need to just regenerate their entire body process. We're going to want to make sure that they're getting some good high quality proteins. So another thing is going to be pushing the fruits, pushing the vegetables. Sometimes it's important, as they might not have had those things for a period of time, to reintroduce them slowly, to encourage them to get fruits and vegetables in different forms. Maybe they do applesauces, or maybe they even do a little fruit juice for a little while, but just getting some different things incorporated so they're getting all of the different nutrients they need. I have on here moderate caffeine intake and then none preferred. I wish I could just say no caffeine, but in working having been exposed to working in addictions fields, between the caffeine and the nicotine, I don't think that anyone would show up if there was no caffeine available. So while it is, caffeine intake is definitely going to have the ability to increase anxiety going through this. They're already going to be in a high anxious state. It's going to decrease their appetite, and that's exactly what we're trying to avoid. And then it can interrupt sleep, so it can interrupt their ability to, we're having that insomnia issue going on. So as you can see, caffeine is really going to be, essentially you're just going to be encouraging them to do minimal amounts of caffeine. So if you have to start with 1 to 2 cups a day, that's great. 1 cup really being about 8 ounces. Our general cups of coffee are usually closer to about 12 or 16. So just really supporting them and educating them around how caffeine is contraindicated, especially in the state that they're in. There's also some different indications that caffeine can really increase cravings for drug and alcohol. So to just avoid that stimulant in general is actually going to be the most helpful. So just some different things to consider when you're working with this population, and really what it is that they're open to hearing and what they're open to working on. So we're going to switch over and we're going to start to look at some of the different drug abuse situations, the medical components, and then also some of the different dietary interventions that will be helpful. Again, we have an hour, so I picked some of the key drugs that are out there, and also the drugs that really you see over a long term having those strong impacts on food intake, on malnourishment, on different GI issues. So that was kind of what I was going for here. We'll start with the cannabis, the marijuana, and go through, I went more so with some of the different medical components, and I tried to avoid some of the different behavioral components, but anxiety and those other things are definitely going to be in there. So in looking at the use, and right now we're talking about this drug actually being used, with marijuana we're looking at impaired balance, increased heart rate, increased appetite to get the munchies. We have anxiety, panic attacks. There can be coughing, respiratory infections, and addiction. So I put a little bit on here whether or not all of these are addictive drugs, but I was looking at some that weren't, so I wanted to include that in here. So when you look at the marijuana, I know that one of the big components that we'll talk about for nutrition interventions is that appetite piece. So oftentimes when they're on the drug, they get the munchies. They tend to overeat during that time, but what can also happen when they come off the drug is they know that they've done that, and so that there's a restrictive component. And looking at cocaine, which is a stimulant, we're looking at increased heart rate, blood pressure, and temperature. All of those are elevated. We're looking at a decreased appetite, tremors, anxiety, insomnia, cardiac issues, stroke, seizures, addiction, and then the nasal damage component. Oftentimes, well, majority of the time, cocaine is a snorted drug, and there is extensive nasal damage. So we'll talk about how that impacts intake as well. We're looking at methamphetamine here, another stimulant. Again, increased heart rate, increased blood pressure, increased body temp. We're also looking at a decreased appetite, tremors, anxiety, insomnia, cardiac concerns, strokes, seizures. Here we have dental issues, kidney, lung, neurological damage, and also addiction. There's also a component of the wounds and the different wound healing that needs to play a role. We'll go into that a little bit as well. MDMA, ecstasy, quote-unquote club drugs. Here we have anxiety, chills, sweating, muscle cramps, sleep issue, hyperthermia, hyponatremia, anxiety, addiction. What was really interesting to me as I was doing a lot of research and discussion about these different club drugs, the ecstasy component, I did find that there was there was some sort of a little bit of a discrepancy between whether or not this drug is addictive. But what was also really interesting is the component with regards to the hot clubs, the excessive dancing, the fact that this drug actually increases sweating, and then you have the different electrolyte imbalances that go along with that. So this drug is actually a lot more about adequate hydration and electrolyte balance than any of the other drugs, which I found to be really fascinating. We'll talk a little bit more about that too. We have the street opioids, heroin and opium. Here we have dizziness, nausea, the slow breathing, which slows down the GI tract, and therefore we have constipation. We have endocarditis, vomiting, or sorry, HIV, weight change, and then addiction. So oftentimes it was interesting with this drug because specifically there can be a weight increase, they can have weight gain, or they can have excessive weight loss. HIV is related to the sharing of needles. So some different things to look at with regards to the street opiates. So what we'll do is we'll kind of take each drug and we'll go through some of the common withdrawal symptoms, and then we'll talk a little bit about the specific nutrition interventions that are going to be very critical. So at the top here, I've got all, meaning that all of the withdrawals from all of the below listed drugs include anxiety, craving, agitation, and fatigue. So agitation being a mood agitation, a body agitation, fatigue generally as it relates to the body, the discomfort, and the different side effects that come from the physical withdrawal from these drugs. So with the marijuana, you have the irritability, we have a difficulty sleeping, and then there can be some nightmares associated with it. So we talked about how during the use, they have that binging or that increased appetite. With the withdrawal, there can be some different responses when it comes to the appetite. So some tend to continue to kind of exist in that binging state because they're so used to doing that, whereas others will tend to not really have the hunger fullness cues available, and so they'll tend to not eat. So you really do need to be careful about how they're eating, how they're making decisions about food, and learning to reconnect. We have cocaine here. We got the depression. There's an increased appetite as while they're on the drug. They have the decreased appetite through the withdrawal symptoms, and as they come back to more of a normalized body function, you're going to see increased appetite. Again, the insomnia piece, and then psychomotor agitation as they go through the withdrawals. The meth, we have depression, and then we have also the increased appetite. As they had lost their appetite before, we're going to get the increased appetite once they start to go through withdrawal. The ecstasy, low mood, stress. There's a sense of, or there's a period of time of emotional sensitivity. There's this sort of fog that continues as they withdraw from their high. And for oftentimes there is also a small loss of appetite. I didn't put it on there because it's not quite as strong as some of the other ones, but for many of them there can be a loss of appetite. When we're looking at the opiates, we have the restlessness, there's muscle and bone pain, there's insomnia, diarrhea, vomiting, cold flashes, leg twitching, pretty extensive withdrawal symptoms that are happening as they come off the heroin and the opium. So for nutrition support, I thought, not that anyone would want it, but Hugs Not Drugs, you think about they're working, and again, I didn't go into this so much, but they're really working on, as they're in treatment, as they're going through the detox, as they're going through with the withdrawal, they're also starting to connect to the different therapeutic reasons, or the different therapies and the reasons why they have turned to these drugs as a form of coping in the first place. And so I saw this Hugs Not Drugs, and it kind of made me smile because they're usually looking for some sort of a nurturing process. And as the dietitian can come in and play a role, it could actually be this amazingly positive role during this time of fear, this time of discomfort, because they're going to come in and they're going to essentially be learning in detail what it is this drug has done, would continue to do, and where their body is in the process. And through that education, they can gain a lot more understanding of why they essentially turned to the drug in the first place and how that drug was used in order to make them feel better. So I kind of thought of a dietitian in this role as being the person that gives hugs, but that was, I guess, my own little joke. So I'm looking at the marijuana. What's going to be really important for nutrition support is, again, stabilizing the hunger fullness cues. Oftentimes, they're not going to have known the feelings. All they had was the different indications from the drug. And so you're going to want to normalize intake. So that again, is kind of getting that meal plan going where you've got some different meals, probably 3 meals, probably 2 to 3 snacks, and you're going to start to get them to really play with, where am I? Am I hungry? Am I full? Am I just eating because this is what I normally did? Am I eating because, you know, I feel like I should? Am I not eating because I don't know if I should? Working a lot with educating on that stabilization. There's also that metabolic piece. Their body is going to be really trying to stabilize, and so you're working with how their metabolism is functioning. So their hunger fullness cues, their weight may fluctuate, and you just need to keep an eye on that and offer support. The cocaine, as they get the increased appetite, a lot of times I've heard patients talk about using the cocaine as a means to suppress the appetite. So there's going to be a lot of resistance. Once they start to get those hunger cues back, there's going to be a lot of resistance to any kind of a weight gain, a lot of resistance to those body changes, but offering support, again, around the normalization of that process, having them connect with hunger fullness cues, having them identify what it is their body needs. And along with that is that nasal damage we talked about. And any time that our aroma, our ability to smell is impacted, it actually impacts our taste. It happens a lot with chronic smokers as the taste buds on their tongue are damaged as well. So if we have this nasal damage, we're going to have things smell differently, and that's in fact going to impact our taste. Now, for somebody who hasn't been eating a whole lot because they don't have an appetite, now they're starting to have to eat more, and they're kind of realizing that food doesn't taste the same. We need to offer support around that. So encouraging them to try different things, encouraging them to season their food differently, encouraging them to eat foods that maybe they didn't think they liked in the past, and gaining acceptance around the fact that foods they may have really enjoyed just don't taste the same anymore. With the methamphetamines, again, you're dealing with an increased appetite. To some extent, the same with regards to a desire for being thinner or losing weight. I don't think that it's quite the same as those who use the cocaine, since meth is so powerful, but it is another component that plays into it. So being mindful of weight gain, but also being mindful of dental issues. There's extensive dental damage with meth. And so making sure that you're supporting them getting their teeth looked at, making sure that they're getting their mouth taken care of. There can be gum damage as well. And then making sure that they're eating the right foods. For somebody who has extreme teeth sensitivity, you may want to avoid foods that are really hot or foods that are really cold. Some people may be sensitive to foods that are a little bit sweeter or foods that are a little bit bitter, just depending on the sensitivity of their teeth. The other thing is, if they're missing teeth, if they've had teeth pulled, if they've had some dental work done, they may need to eat soft foods. So soft foods can include foods that are maybe even like pureed or doing a little bit more of the liquid. I talked about supplements here. Supplement meaning if they do some sort of a supplement drink. So I'm talking about Boost or Ensure or even Carnation Instant Breakfast. It's a powder that you add to milk. Those can be really, really helpful because they have a balance of nutrients. And when you're looking at some different wound healing that comes with the meth abuse, along with some of the dental issues, it may be important to not just put them only on supplements, but to encourage specific foods for them, and then to throw the supplementation in as well in order to stabilize their body, in order to really get the weight gain that they need as well. Looking at the ecstasy, the MDMA, we talked about this a little bit, but that adequate hydration and that adequate electrolyte balance, especially during and through the withdrawal and through the long term, making sure that those lab values are being checked on a regular basis, those electrolyte values specifically, and then really supporting what it is that they need. There can be there can be a lot of danger in having electrolyte imbalance, heart attack, those kinds of things. With the opiates, we're looking at the extreme physical discomfort that they're going through in the withdrawal, and then we're also support weight stabilization. Like I said, some tend to be a little bit more on the overeating side, and others tend to be on the restricting side. So what we're working with is getting through the physical discomfort, allowing the body to stabilize and normalize, working with the hunger fullness cues, and then supporting weight stabilization, whether that's getting them on something that's a little bit more mindful around their eating, or encouraging some weight gain and some restoration. So the third the third aspect that we're going to move into here is the prescription drug abuse. So we're going to talk on these three different categories specifically. There isn't quite as much detail with regards to the nutrition support when it comes to these different drug abuses, but we're going to go through some of them. I think that what's been really interesting for me working within the eating disorder field, and again, why would I really have much education on prescriptions and how it impacts appetite, seeing as that's not something that I'm ever going to prescribe, but specifically within working in the fields of addictions, working in the field of mental health, eating disorders, there is a lot of different prescriptions that are used effectively and prescriptions that are abused, or the med-seeking patients who will report certain symptoms in order to get a prescription that they know that they want for a specific reason. So I thought it was really a great education for me to learn more about these drugs and some of the different side effects that they can have, and how I as a dietitian can support that. The first we're going to look at is the stimulants. When I think of the stimulants, I think of the Adderall, and I think of Lindsay Lohan. I don't know why I always go there, but I feel like she was really one of the first celebrities to talk about the Adderall abuse. We all watched the weight loss. We all saw the different things that she was going through, and it really kind of lined all of that up. But someone who, again, as I go through these, this is prescription drug abuse. This is not taking the prescription as it is intended, although some of these things obviously happen when taking it as intended, but this is the abuse aspects of it. So we have increased energy, increased alertness. We have irregular heart rates, hyperthermia, cardiovascular failure, and seizure. So very, very scary. With all of these, any of these, overdosing can obviously lead to death. The opiates, we have the codeine, the morphine, the methadone. Here we're looking at the pain relief, the drowsiness, the nausea, and then as things are slowing down, that's where the GI tract also is slowing down, and you have the constipation piece. We have the central nervous system depressants, drowsiness, relaxation, those types of things play a role. So looking a little bit more at the withdrawal, with the stimulants, we've got the appetite back. So oftentimes, specifically with someone who has eating disorder tendencies, they've gone out and looked for the stimulant in order to reduce their appetite. Now their appetite's back. You're looking at weight changes, a lot of dissatisfaction with body size. We have the fatigue, the insomnia, they have the psychomotor agitation. The opiates, we're looking at the restlessness, the muscle and bone pain, insomnia, diarrhea, vomiting, cold flashing, leg twitching. There's a lot of different side effects that come with the withdrawal symptoms from those. The depressants, we're looking at having reducing the dosage slowly, as it can lead to seizures and death through the addictive properties of that drug. So this is the general nutrition support that I would suggest for anyone who is going through detoxification, who is going through withdrawal, and who has essentially had any kinds of side effects from those things. Excuse me. So the first thing is nausea. Nausea is a very common side effect for anyone going through any kind of withdrawal or discomfort. And in order to best deal with nausea, you want to avoid any foods that have a strong aroma. So oftentimes you go to a restaurant and you can smell all of those amazing flavors as they're making the foods in the kitchen. Well, those aromas are going to make someone who's nauseous essentially vomit. So you're going to want to avoid foods that are hot, anything that has a strong aroma, anything that's kind of garlicky, oftentimes foods that are at room temperature, and even cold foods can sometimes be the best for someone suffering with nausea. Ginger, there's a couple different ways that you can have ginger. You can actually get kind of a dried ginger. It's got like it's a crystallized dried ginger that they can suck on. They have ginger lollipops. And sometimes ginger can really help with someone who's suffering from an extreme nausea through withdrawal. Diarrhea is a common side effect. You want to push fluids. Diarrhea is going to be a loss of fluid in the body as the body is not absorbing and processing foods effectively. So you want to push fluids. Again, we go back to the water. Maybe the Gatorade if they don't have an electrolyte imbalance. If that's not a concern, just utilize the Gatorade. You could do something of a combination. If the water is just something that doesn't sound good to them, maybe do just a mixture, half juice, half water. And then some foods that are a little bit higher in fiber to kind of help bind things up. If they're having overall GI discomfort, so stomach aches, stomach cramping, just some generalized issues, these are some good rules of thumb initially. So these recommendations aren't recommendations that you would want to make for the long term. Some things to do are to limit dairy. Dairy products can be a little bit more irritating to the GI tract, especially as some people have some lactose intolerance and some different issues. Just eliminate a little bit of dairy in order to avoid that. You want to avoid spicy foods, sometimes foods that are high acidic as well. Raw veggies that are a little bit more effort to process. So just cook the veggies, maybe overcook the veggies a little bit. Avoid some of the different fibrous fruits. Do fruits that are a little softer. And then limit sweets. And by sweets, I mean anything that's really, really high in fat or anything that's really, really high in sugar. And again, this is for a short-term period, just to allow the body to kind of normalize, get the GI tract to allow itself to heal, and just reduce any kind of agitation. Some of the initial foods that can be really good are different toasts. Toast with a little bit of jam, toast with a little bit of peanut butter, toast with a little bit of butter, and just doing some plain kind of grain toast type things. Some different crackers, saltines are a common one, but really any kind of cracker, as long as it doesn't have a lot of seasoning. There's different crackers out there that are like rosemary and onion, and those are all going to have a lot of strong aromas, so you'd want to stick to some of the more basics. Plain white rice, plain brown rice can be really great. Again, you can add a little butter to that. Soups, different soups at room temperature so that they don't have that aroma can be really helpful. Like I said, some soft fruits. So we're talking about some of the different berries, nectarines, peaches, even like canned pears, just getting to some basic fruits. Eggs can be an excellent source. Even if you do like a scrambled egg, maybe you just serve it at a room temperature so that it doesn't have a strong aroma. Fruit smoothies can be really terrific, really soothing. They're cool. You can do them in lots of different ways. You could just do something with maybe a soy milk or regular milk, do some fruit, maybe throw in a little bit of yogurt or Greek yogurt, a little bit of ice. You can really kind of make whatever it is that sounds good to them through a fruit smoothie. A milkshake, I know I kind of talked about limiting the sweets, but for some people, again, the cold milkshake can be really soothing. It's going to get a lot of calories in for somebody who's malnourished, so it can be a nice alternative. I don't know why the comment's there. Maybe I had other ideas. Nuts. Nuts are a great one. Cheese can actually be a really nice, a nice suggestion as well. And then for those that are significantly malnourished, somebody who's significantly underweight, significantly compromised, we talked about the replacement drinks, the supplement drinks. I listed a few there, but they've just got a nice balance of nutrients. So if you encourage some food and then incorporate some of these replacement drinks, meal replacement drinks, they should start to really head into that path of healing. Really, some of the long-term goals for somebody who is going through the detox process and is essentially receiving treatment for their addiction. When it comes to dietary, taking care of their bodies is going to be as important as taking care of their psychological, their mental health. So for many, we've talked about there's going to be some weight gain or weight stabilization as they start to regulate their intake. It's really going to be important for the dietitian to be there and to support them in the changing body. They're going to have a lot of resistance around this, and we're going to talk a little bit about how that plays into the eating disorder. They're going to have the muscle and the protein loss. That's essential for their body to restore and to rebuild. So high quality proteins, animal source proteins can be really great. metabolic changes, they're going to probably fluctuate back and forth. They may have a they may be hypermetabolic, and then they may slow down their metabolism. Then it may go back up a little bit again. As they go through this process and their body is healing, there should be the idea to expect the unexpected. Restore the GI function, get them some comfort. If you have an upset GI tract, it is very, very, very unpleasant. And then, as we talked a lot about the fluid and the electrolyte balance. We're getting close to time. So I had put this on here. I didn't go into drugs taken in combination, but obviously it intensifies all risks and can lead to death. Corey Monteith just last weekend overdosed on heroin and alcohol. He was only 2 or 3 months out of rehab. So, you know, one time, one session can really end your life, and I think that this has been a powerful message, this young 31-year-old and his loss of life. So I wanted to go through how to identify an eating disorder really briefly, and you'll have all of these slides, but 35% of those who are dealing with alcoholism, drug use, substance abuse also struggle with an eating disorder. And what's going to be really difficult is they admit to your facility and they're going through detox, and you bring a dietitian in to assess an eating disorder. You're not going to get anything out of them. It's almost impossible initially to really understand where they are with their food and if an eating disorder is present. So we go in and we generally do as much of an assessment as we can to make sure that we're keeping them comfortable through the initial process. But then after about 1 to 2 weeks, as their intake stabilizes and as their side effects of their detox start to reduce, we go back in and redo a nutrition assessment. And we make sure that they're getting adequate nutrients, and we also assess for an eating disorder. So I went through and I created really a list of red flags. I think that a good rule of thumb is to be on the lookout for about 3 of these. If you're seeing 3 of these, then there's a strong indication that there could be an eating disorder present. And what's going to be really important as they start to receive treatment for their chemical or substance or alcohol abuse is that they don't addiction switch. We don't want them to get sober and then have this full-blown eating disorder, although that is what happens. The number of times that I have had someone come to treatment for specifically their eating disorder who's 6, 7, 8, 9, 10 years sober, they'll talk about how difficult the eating disorder is compared to working through their addiction. So some of these red flags are a weight loss or a gain or 2 to 3 pounds in 1 day or 5 pounds in 1 week. This can happen if they have severe edema, if they've got lots of different things going on, then it can happen. But having strong weight fluctuations like that is very concerning. If you find that they have daily exercise, we talked about going on moderate walks can be helpful, but if they're doing high intensity, greater than 20 minutes, and if they have a strong reaction to having their exercise modified, that could be an issue. Reported but undocumented medical or food conditions. We've got the gastrointestinal issues, food intolerances. Lactose is common, but if they have a gluten intolerance, if they're allergic to red meat, if they go into some different bizarre foods. I listed some of the common food allergies down here, but some of the different food allergies that may seem to have an allergy to red meat is kind of rare, but it doesn't mean it's not possible. So you want to ask for some documentation of those different things. If they're now overly concerned with being healthy, if they have an obsession about the food that they're eating and being served, there's a term for this in the eating disorder world called orthorexia. That's something to be on the lookout for. If they're doing fluid intake, whether they're doing excessive fluid or even restricting fluids, we talked about the caffeine component can be difficult, but excessive amounts of water. Caffeine and nicotine are a stimulant. Nicotine's also a depressant, but they're going to suppress the appetite, and they're also going to stimulate the bowels, all things that the eating disorder really enjoys. Excessive condiment use. Hard to monitor, but you'll notice if they're doing some different bizarre food behaviors. Many bathroom visits, especially after meals and snacks. And it's important to make sure that you're monitoring any medical concerns because they can present as either being a side effect of the detox or long-term side effects of their substance or chemical dependency, or if it's an eating disorder. So I've listed some of those there for you. Oh, that was it. So the other piece is the GI or the bowel issues. So if they're seeking out laxatives, if they're seeking out enemas, diuretics, those kinds of things, another red flag. So lots of different things to be on the lookout for when getting someone through the treatment of their chemical dependency, their substance abuse, but also being on the lookout for moving into some sort of disordered eating or eating disorder tendencies. So I want to thank you all so much for joining us, and I'll go ahead and turn this over to Nancy. She can give you all the details of how to get your CEs, and please feel free to contact me if you have any questions about anything I presented today, and have a wonderful Friday.
Great. Thank you, Megan. I know I learned a lot, and I'm sure our attendees did as well. And again, I also want to thank you for joining us. Immediately following this webinar, you will receive an email with an evaluation form and the post-test attached. Once you complete those forms, you need to return them to tri@rosewoodranch.com. Upon receipt of the post-test and evaluation form and successful completion of the post-test, a score of 80 or better, a CE certificate will be sent to you. I'll bring this back up so you can see what you're going to need to do. But first, I want to let you know that if you have any questions or if you would like copies of today's slides, that you can get those by also emailing tri@rosewoodranch.com. And for additional information, and or if you want to listen to this again next week, we will be posting it at the rosewoodinstitute.org website. Again, we'd like to thank you for taking time out of your busy schedule, and we appreciate the time you took with us. Have a great day. Bye-bye.